My name is Ken, and I have a rare disease called polycythemia vera. It's one of the myeloproliferative neoplasms, and it affects my blood. It's a bone marrow disorder. My blood, as someone described it, gets thick like jam.
My name is Amanda, and my daughter Hannah has been diagnosed with autoimmune encephalitis, and I am her carer. And autoimmune encephalitis, you wake up one day and you realize your life that you had yesterday no longer exists. She has changed, and therefore you have changed, and all of your life has actually changed. It's often hard to get a diagnosis because you're dealing with a myriad of symptoms. And the fatigue and memory loss can be really difficult to manage and can create a lot of isolation in their life and also in your life as the carer.
Hi, my name is Marcus Perdue, and I have Friedreich's Ataxia. Right, Friedreich's Ataxia affects mainly my gait. I walk with a walker 100% of the time. The main thing I have to do is I have to prepare. If I was to go somewhere at the norm, I've got to look where I'm going. There's stairs, there's split options. And that was frustrating at the start, but now it's second nature. When I was diagnosed with Friedreich's Ataxia in 2009, I found it being a rare disease quite daunting at the start, thinking there was not going to be the support services in place that would be in place. But I quickly found out there's a lot of people in Melbourne that do deal with my disease, and I've been supported the whole way through.
Hi, my name is Patricia. I have visual snow. Living with visual snow is quite challenging because you can't turn it off. You have visual disturbances and non-visual disturbances 24/7. So it is a constant exercise of trying to keep yourself calm, go on about your day-to-day, and just trying your best to not panic given the circumstances and continue to do your best.
Hi, my name's Nadine, and I have a primary immunodeficiency. To anyone out there who's struggling to get miscellaneous symptoms diagnosed, I strongly encourage you, keep at it and get diagnosed. It's completely worth it. The current treatment that I'm on is fantastic and has absolutely transformed my life. What my condition means to me is that I need to be very careful about managing infections, and I've got to work hard to balance my energy levels. So I am very careful on choosing what I prioritize. And I like to focus on what I can do, not focus on what I can't do.
There's a few challenges in studying rare diseases. The first is none of the clinicians out there have a lot of experience. So we need to work together collaboratively and have large centres of expertise to see enough cases to really have the power to do good research. Number two, I touched on it before, we need genomics to get an accurate diagnosis. And in the cases of MPNs, we need better mouse models. So all of these things need to work together to be able to test new drugs and then move into clinical trials to help patients with MPNs.
Hello everyone, my name is Mastura Monif. I am a researcher working on an Australian Autoimmune Encephalitis consortium project. We are leading this project from Monash University. I would say that the most challenging part of diagnosing autoimmune encephalitis is the fact that it mimics many other conditions, such as psychiatric conditions, such as cognitive or behavioral or memory type of conditions. And in that scenario, because the presentation is so heterogeneous, it makes the diagnosis quite difficult.
My name is Dr. Ian Harding, and I research brain changes in people with Friedreich ataxia. Research in Friedreich ataxia has already given us a genetic test for diagnosis and an understanding of the core mechanisms of the disease. But the biggest challenge in researching Friedreich ataxia today is ensuring that we can perform large-scale research studies and clinical trials as we now progress towards treatments and ultimately the cure. These challenges have actually stimulated the growth of a tight-knit community of consumers, researchers, advocacy organizations, and funders who all actively communicate at all steps of the research pipeline. And it's the strength of this integrated community that's essential in our progress towards a cure.
Hi, I'm Emily, and I'm a primary immunodeficiency researcher. The biggest challenge for diagnosis of patients is to identify the DNA error that causes disease. So because we have a lot of DNA errors naturally, we share a lot of these amongst us as a population. So to find the rare DNA error that causes disease in primary immunodeficiency patients is very, very difficult. And it's much like finding a needle in a haystack. So we have to find that needle in a haystack to then move on and be able to try and do other strategies to better diagnose our patients.
Hi, my name is Meng Law. I'm Program Director of Radiology and Nuclear Medicine at Alfred Health and Professor of Radiology at Monash University, also in the Department of Neuroscience and Electrical Engineering. I'm also Director of the Eye-Brain Research Lab at Monash University, and one of the diseases that we're studying is brain tumors. And you would think that brain tumors is a reasonably rare disease, partly because there are challenges with making the diagnosis.
And I would say the most challenging part in regards to diagnosis of glioblastoma or brain cancer is the fact that glioblastoma presents quite late in terms of the actual disease presentation. So generally, when the diagnosis happens, the disease is already quite well established, and that creates a challenge for the patient, a challenge for the clinicians as well.
Hi, my name's Associate Professor Jo Fielding, and I'm investigating the little-known syndrome known as visual snow syndrome. One of the big issues with this disorder, or this syndrome, is that it's very difficult, if not impossible, to diagnose. All of the symptoms are strictly sensory in that they are perceived by the individual, but they're not measurable. They're not measurable by any clinical examination or even on an MRI scan.
What's the most challenging part about studying glioblastoma? I would say the most challenging aspect of it is the fact that it's such an aggressive condition and that there's not much available in regards to treatments. One of the most exciting aspects of our work is that we have been able to identify a particular protein being involved in glioblastoma or cancer cell proliferation, and we're trying to understand how we could block this protein and to see if that can actually reduce tumor cell number. So this is quite exciting, but of course, we do need to do more to understand the disease in a much more rigorous manner and to hopefully develop treatments in the future.
Light at the end of the tunnel. Firstly, it's important to know that the Health Minister has funded NGS testing in MPNs. So as of July 2022, most patients will be able to get a comprehensive genetic test undertaken, and that will inform their treating doctor as to potential therapeutic options. And the trials are expanding a lot in Australia, so there are now opportunities to enrol in clinical trials at most centres in Melbourne and other major cities around Australia. So there's certainly hope for improved medications to improve the survival of people with advanced stage MPNs.
So once we've identified these DNA errors in primary immunodeficiency, we have to show that they cause impaired immune function. Unfortunately, there are no standardised assays to enable us to do this. So our job is to develop these so that we can diagnose more patients quicker.
So one of the biggest issues I face investigating visual snow syndrome is that even though the symptoms can be extremely debilitating, it's not progressive to our knowledge. It's not life-threatening, and it's not widely recognised by the medical community, so funding is a great problem. Having said that, we have had some philanthropic funding from a couple of organisations, the Visual Snow Initiative. Ion Vision is another organisation that's collecting money for us at the moment, actively fundraising, as is VSS Germany.
One of the challenges of studying autoimmune encephalitis is the fact that it's such a rare condition. And in order to actually stand it in a more, understand the condition in a systematic manner, we need to have the numbers. And to do that, we have formed the Australian Autoimmune Encephalitis Consortium, which brings multiple centers from around the country together to tackle the problem of autoimmune encephalitis facing the Australian population.
Some of the more positive aspects of our research and research in neuroscience in particular is the application of artificial intelligence. So, you know, it's difficult for a human physician or clinician to incorporate so much data from either imaging or pathology or genomics into try and figure out what might be not only the most optimal diagnosis, but then the most optimal treatment for a patient. And I think that because there's so many data points and so many elements involved with that now, incorporating artificial intelligence to try and analyze all this data, I think is a very positive step in research into rare disease and particularly brain tumors. So then now we're developing some algorithms and some models in using artificial intelligence to analyze a lot of this data, and then we can provide perhaps a more accurate diagnosis and also propose the most optimal treatment. And this will include potentially looking at the numerous clinical trials that are out there in the research environment, as well as providing the most optimal surgery, chemotherapy, and radiation for brain tumors. So I think that's a very positive step in the research that we're doing, and also the research into rare diseases and brain tumors in particular.